Welcome to The Explainer. Today, we're bringing some clarity to a topic that, let's be honest, is often surrounded by a lot of fear and confusion: hospice care. These widespread misconceptions can actually cause families to wait way too long to get the support they need. But understanding the truth, that can empower you to make truly compassionate decisions.
Just think about that for a second. When you hear the word hospice, what's the first thing that comes to mind? For a lot of people, it brings up feelings of anxiety, finality, maybe even guilt. It's a heavy word, for sure, and that weight often comes from a place of misunderstanding.
But here's the thing. It really doesn't have to be that way. Our goal in this explainer is to tackle those fears head-on, replace them with the actual facts, and show you how hospice care is really about supporting the quality of life for both patients and their families.
So, here's our game plan. We're going to walk you through everything, step by step. We'll start with why we get it wrong, define what hospice actually is, and then we'll systematically bust the 5 biggest myths before we reframe the true goal of this kind of care.
Okay, let's dive right in. Section 1, the hospice misunderstanding. Why do so many of us have a picture of hospice that just doesn't line up with reality? Well, it often boils down to a pretty simple but really profound confusion about what its purpose is.
So let's start with a solid foundation. The main goal of hospice is to make a person as comfortable as possible. It is not about giving up or ending life. It's about a shift in focus. It's about improving the quality of the life that's left. So, if it's not just about the very end, what does hospice care actually do? It's so much more than people think. It's a complete wraparound system of support. Think of it like a whole team that comes together. You have nurses who are laser-focused on managing pain and symptoms. You have support for the emotional and spiritual needs of not just the patient, but the whole family. You get assistance with personal care, and, this is critical, there is always help on call 24/7.
Okay, now that we know what hospice provides, let's get into the most common and, frankly, the most damaging myth of all, the one about timing.
This is probably the #1 reason families don't look into hospice sooner. They think it's this last-ditch effort, something you only do when someone has just hours or days left. But that single belief prevents people from getting months of really valuable support.
The reality is a world away from that misconception. Instead of being this crisis intervention at the very, very end, hospice is actually designed to be a supportive service that can make life better for a pretty significant amount of time. So where does this idea even come from? Well, it's often tied to Medicare eligibility. A doctor has to certify that a patient may have 6 months or less to live if the disease runs its normal course. But here's the key thing to get. This is a clinical guideline to get you support. It is not an expiration date. People can, and very often do, receive care for much longer.
And that misunderstanding of the 6-month guideline? It leads directly to the second huge fear, that just accepting hospice care is like starting a countdown clock, that it's basically a death sentence.
And this quote just brilliantly shows why that's not true. This is from a real patient's daughter. With her mom's pain and symptoms finally under control, her condition actually stabilized. She improved so much that she was discharged from hospice. Patients can leave hospice care anytime and come back later if they need to.
Next up, let's clear the air on medical treatment. A huge fear is that if you choose hospice, you're suddenly cut off from the medical system and you have to abandon all the doctors you trust.
This belief forces this awful, false choice on families. Either you pursue aggressive treatments to cure the disease, or you get comfort care, and there's nothing in between. But that's just not how hospice works.
What's so important to remember is that the care doesn't stop. It just refocuses. Treatments for pain and other symptoms absolutely continue. In fact, that's the main goal. And your regular doctor, they can and often do work directly with the hospice team. The goal just shifts from trying to cure the disease to maximizing comfort and quality of life. All right, let's finish our myth busting with 2 really practical things that always come up. Where does hospice happen, and how in the world do you pay for it? First off, a lot of people picture a specific hospice facility you have to move into. But that's not it at all. Hospice isn't a place, it's a philosophy of care. And that care comes to wherever the patient calls home, whether that's their own house, an assisted living facility, or even a hospital.
And what about the cost? I mean, this is a major source of anxiety for families. But here's the really reassuring part. For the vast majority of people with Medicare or private insurance, hospice care is fully covered. This can lift a huge financial burden at an already incredibly difficult time.
So after we've cleared away all those myths about timing, treatment, location, cost, we can finally see the true goal of hospice in a totally new light. It's not about what you're giving up, it's all about what you stand to gain.
This quote from Dr. Ira Byock, who is a leading expert in the field, it perfectly captures this whole shift in thinking. It reframes the entire conversation. The focus isn't death. The focus is life. It's about making sure that final chapter is lived with dignity, with comfort, and with as much joy as possible.
And that's really the question to leave with. By understanding what hospice truly is, this comprehensive support system focused on quality of life, we can change our perspective. We can help our loved ones and eventually ourselves to focus not just on the length of life, but on its depth and its richness, right to the very end.